Hello and welcome. Today, we're going to explore a condition that affects the esophagus, the tube that carries food from your mouth to your stomach, esophageal strictures. We'll delve into what they are, what causes them, how they're diagnosed, and what can be done about them. So, let's get started. Esophageal strictures occur when the esophagus narrows. This narrowing isn't a natural part of the esophagus. It's a result of injury or inflammation that leads to scar tissue formation. The most common culprit: chronic acid reflux, also known as GERD or gastroesophageal reflux disease. Over time, stomach acid repeatedly flowing back into the esophagus can damage the lining and cause scarring. Other causes include swallowing corrosive substances, radiation therapy to the chest, certain medications, esophageal cancer, and even rare conditions like eosinophilic esophagitis, an allergic inflammatory condition. Let's understand what happens inside the esophagus. When the lining of the esophagus is repeatedly damaged, the body tries to heal itself. This healing process involves the laying down of collagen, which forms scar tissue. Unlike the normal esophageal tissue, this scar tissue is inflexible and constricts the esophagus. The wider the area of scar tissue, the narrower the esophageal opening, and the more difficulty food has passing through. This leads to the sensation of food getting stuck, which is a hallmark symptom of esophageal strictures. Esophageal strictures are a relatively common condition, especially among adults. The prevalence directly correlates with the prevalence of GERD, so populations with higher rates of GERD tend to have a higher incidence of esophageal strictures. The condition can occur at any age, but it's more frequently diagnosed in middle-aged and older individuals, likely due to the cumulative effects of chronic reflux or other predisposing factors over time. The symptoms of an esophageal stricture can vary depending on the severity of the narrowing. The most common symptom is dysphagia, which is difficulty swallowing. This can feel like food is getting stuck in your chest. People may also experience heartburn, regurgitation of food or liquid, chest pain, unintentional weight loss due to difficulty eating, and in some cases, excessive salivation or choking episodes. Diagnosing an esophageal stricture typically involves a few key procedures. An upper endoscopy is a common and effective method. A thin, flexible tube with a camera on the end is passed down the esophagus, allowing the doctor to visualize the lining and identify any areas of narrowing. During an endoscopy, a biopsy or small tissue sample can also be taken to rule out other conditions like cancer. Another diagnostic tool is a barium swallow study, where you drink a barium solution, which coats the esophagus, and then X-rays are taken. The barium highlights any narrowings or abnormalities in the esophagus's shape. Esophageal strictures can be classified by their cause, for example, peptic strictures, caused by acid reflux, or malignant strictures, caused by cancer. They can also be classified by their length or location in the esophagus. The treatment for esophageal strictures aims to widen the narrowed area and relieve symptoms. The primary treatment method is esophageal dilation. This involves using an endoscope to insert a balloon or dilator to stretch the stricture. This procedure may need to be repeated periodically to maintain the esophageal opening. In some cases, medications like proton pump inhibitors, or PPIs, are prescribed to reduce stomach acid production and prevent further damage. In rare cases, surgery may be required to remove or bypass the stricture. While it may not always be possible to completely prevent esophageal strictures, particularly those by factors beyond your control, there are steps you can take to reduce your risk, particularly if you suffer from GERD. These include maintaining a healthy weight, avoiding foods and drinks that trigger heartburn, such as spicy or fatty foods, alcohol and caffeine, quitting smoking, eating smaller meals, and not lying down for at least 3 hours after eating. Raising the head of your bed can also help prevent acid reflux while you sleep. The prognosis for esophageal strictures is generally good, especially with appropriate treatment. Esophageal dilation is usually effective in relieving symptoms and improving the ability to swallow. However, strictures can sometimes recur, requiring repeated dilations. Ongoing management of underlying conditions like GERD is important to prevent further stricture formation. Recent research is focusing on developing new and improved dilation techniques and exploring the use of biodegradable stents to maintain esophageal patency while minimizing the risk of complications.